Hi Erin, how are you today?
Oh, I'm good. How are you?
Well, thanks. Let me see what we got going on.
Okay.
Alright. So you filled out this form for me in the waiting room. Perfect. Alright, looks like we have a lot of swelling.
Yeah, it hurts quite a bit.
You're comfortable here?
Okay, thank you.
Yeah. Can you tell me a little bit what's going on? How did it happen?
I work in a daycare, so I was playing basketball with some of the kiddos outside, and I think I just caught the ball wrong.
Okay. How long has this been going on?
It was a couple days ago.
Okay. Are you having any trouble with things at home? I see that you scored, let me add this up. You scored a 35 on your upper extremity functional index, which basically means you are having some pain and difficulty with your daily activities.
Yeah.
So what is it holding you back from doing?
Well, at work, sometimes I'm in the infant room, and so changing diapers has been rather difficult.
Okay.
We also have to write and fill out daily sheets and type on computers for schoolwork has been really difficult.
Okay.
I also have been, it's been causing some issues taking care of my cats and doing light housework around the home.
Sure. Understandable. Okay, so I want to do some measurements on you so we can see where we are now for progress for the future. So I'm going to have you bend, or sorry, straighten your finger as much as you can, and I'm going to measure that. Okay. Yeah, second joint. All right. Now I'm going to slightly bend your finger. I want you to tell me when it hurts too much and we need to stop, okay?
Okay. It's a little tender.
Okay, perfect. And then, can you bend this joint?
It's really swollen, but a little bit.
All right, and I'm gonna push it a little bit too. Okay, perfect. And then, how about this one down here? Can you bend that one?
It's a little bit easier.
Nice, very good. Okay, I also want to do the same thing, give this guy a rest. I want to do the same thing over here, so we just, here, go ahead and get comfy. So we can have some measures to compare it against. So straighten everything as much as you can. Good. And then I'm going to have you bend as much as you can too. And then what about here? Can you bend that one for me too? Okay. Good. Now we'll do some edema or swelling measurements here. We'll just start with this hand.
Okay.
So I'm just going to wrap this around your joint, your injured joint on the other finger so we can get a baseline of where you stand. Very good. And sorry, I'm going to have you do the painful finger again.
It's all right.
Okay. Good. Now to torture you even more, we're going to do, this is called a pinch test.
Okay.
So it basically just measures a couple different pinches and the amount of pounds that you can press so we know how far we need to get from hand to hand. So I'm going to have you start with a 2-point pinch, just like this. I want you to pinch as hard as you can. Good. Do that again for me. Good, and one last time. Good. Okay, now I'm going to have you do the 2-point pinch, or pardon me, the 3-point pinch. Yep, so we're going to do that same thing 3 times. Good. Again. Good. Good. All right, and then finally we're going to do a lateral pinch, so like you're turning a key.
Okay.
Okay, so we'll try that one. Good. Good. And one last time. Good. Now, I'm going to have you do it again on this side. Go ahead and put your elbow or your forearm up here. I don't want you to hurt yourself, but I just want you to try to see where we are. So just same thing here to start, and we're going to see how far you can get. Okay. All right, that's fine. we're just gonna do 2 on that one. Good. And then this 3-point again. How's that pain? Is it all right? Out of 10, what would you say your pain is right now?
Probably about a 5.
Okay. So pretty high up there. And then that key pinch again.
Okay.
How's that one? Is that just hurting you a little bit less? Still
Look,
pretty bad?
Yeah, I mean, it's pushing on the swollen
Yeah.
part, but
Okay. Good. Alrighty, and I want to do one last measurement, but I don't want you to hurt yourself. So when you get to a point, if it's hurting too much, just go ahead and stop. This is a grip test. So we're gonna have you test your unaffected hand, keeping your elbow right here by your hip, and then just go ahead and squeezing as hard as you can. Go, go, go. Very good. One more time. Go, 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 go. Good. And final time. Great. And then again, for the bad hand.
I don't think I'm going to use that finger.
That's fine. Just do what you can.
Okay.
Good. I'm going to have you only do it 2 times on this hand. Good. Okay. Now I want to test your sensation because with all of this edema, oftentimes we can lose sensation. So I want to see where we stand with this finger. And then again, it gives us another baseline to compare off of when we have healing.
Okay.
So I'm going to start on your good hand to see where, if your sensation, where it stands on the good side. So what I'm going to have you do is look away and then tell me when you feel any poking on your hand.
Okay.
Okay?
Yep.
Okay. So you were at the lowest level on that one, so that's good. So we know where our baseline is. And we're going to try the same thing for this hand. Go ahead and look away.
Okay. Oh, yep.
Good.
Yep. Yep.
Good. Okay. I want to grab for you. So it looks like to me we have what they call a mallet finger. So it's just a disruption of that tendon that goes all the way to the end of your finger. It's not a collateral ligament injury, it's most likely the mallet. So what we do to treat that is we're going to put you in an orthosis. And it's very important that we keep that on for at least 6 weeks, and we're going to check it. So I want to try to find one, see if this one fits over your swelling. I know this is going to be a little tender. How's that feel? It's okay?
Yeah.
Do you feel like it's pinching anywhere?
Mm-mm.
Okay. So why don't you go ahead and put your hand up here for me. So I'm going to give you some tape to bring home so that you can change tape out if you need to, but this stays on 24 hours a day, all day for hygiene, showering. If you can put a plastic bag over it, we want to try to keep it dry because if you do need to change it, that means we are risking bending that joint again. If we bend that joint again, we have to start our 6 weeks all over again. So super important that we keep this on and that we keep it dry. So now that I've gotten it on, I want you to be comfortable with taking it on and off yourself only when you need to clean it.
Okay.
Or if you get it wet. So like I said, again, keeping it on as much as possible. But you're just going to easily wrap off this tape. I'm actually going to move this towel out of the way.
Okay.
I want you to keep your hand flat here on the surface. And I'm going to just gently remove this tape. And once you get it off the back, you're going to be able to easily slide it, keeping, once again, this finger flat.
Okay.
So keeping that finger flat, why don't you go ahead and put your other hand on that for me. Perfect. So then you can use a washcloth and just easily clean it if you need to, just like that, keeping it just how you have it. So So I want to give this to you, and I'm gonna have you practice it.
Okay.
So again, just slowly sliding right over that finger. Great. Perfect. And then you'll just simply wrap a piece of tape around it. Great, how's it feel?
Good.
Good.
Not too hard.
Great. You feel comfortable with donning and doffing it on your own?
Yeah, I just gotta make sure I keep it straight.
Right, exactly. And then if it gets wet, just make sure you dry it out before you put it back on. And then fresh tape.
Okay,
Great.
I can do that.
After 6 weeks, well, I'll have you come back the next, let's see, what is today, Monday? I think I'll have you come back on Friday. I want to check that edema. If that's gone down, that's going to leave too much room in your orthosis. So that's going to allow you to then bend again. So
Okay.
we need to make sure that doesn't happen. So I'm going to have you come back on Friday, and then I'll see you a couple of times depending on how that edema goes for the next few days. Elevation and ice is really important. You can do that a couple of times a day to keep that edema coming down. And then after our 6 weeks, we'll pop this off and we'll see if we have an extensor lag, meaning we'll see how far down that joint is actually going. If we reach 0, great. We're going to start with our active range of motion exercises. So we'll do some tendon glides, we'll do some dorsal blocking. I'm going to have you use some theraputty where you can pinch and pull, and do some raking with your fingers in and out of the theraputty, and then some simple clothespin things. And I'll send you home with theraputty so you can do these things at home.
Okay.
And then if we're still progressing and we think it looks good, we'll work on strengthening with those other activities. If we reach 12 weeks and we're not seeing the improvement we need to, we'll have to refer you on to an orthopedic. But that's just, we're going to try everything we can first before we get to that point.
Okay.
Let me send you home with a patient education form. So everything that we just went over is explained here. If you have any questions or anything you can't answer from this, please give us a call. It goes over keeping that orthosis on 24 hours a day up until you see me again, and I want to just see how that swelling is. We won't be starting any exercises until after we get to that 0 degrees there. So it may be 6 weeks, it may be 8 weeks, but we're hoping for it as soon as possible. And then we'll work on then range of motion and then strengthening. Be sure you keep it dry, keep it covered for hygiene. If you do have to take this off, not a problem. I'm going to give you some tape to take home, but I want you to be sure you're keeping that joint straight. So if you have to take it off, just keep that joint across, like at the end of the table, and it'll help you keep it straight. Maybe if you have someone to help you slide it back on, you can just simply slip it right over the top of your finger there and then retape it.
Okay.
Keep it away from your cats. We don't want them chewing on it. But yeah, we're going to try to get you better as soon as possible and avoid surgery.
Good. Sounds
Great. Thanks, Erin.
Thank you.